my boss and I were at a meeting with the provincial director of health to discuss which clinics we should visit to kind of gain an accurate picture of the situation there. And while we were there, one of the two pediatricians in the district began to tell us how this isn't just, it's not just the state of infrastructure that we need to worry about. By rebuilding the NICU there, we're just addressing a symptom of the disease and not, the root of it. He said, and it stuck in my mind that it's better to fix the tap than to mop the floor. And that was kind of a phrase that stuck with me because, in this case, the neonatal mortality rate wasn't a problem that was isolated to the hospital. It was a problem with the roots and it was a problem with roots in every level of care beneath that too.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 160. Hi everyone, Omaya Richards here. Thank you all so much for joining me. Greatly appreciate you all. Be sure to follow me on Instagram at the PH Millennial. Subscribe, leave a like, do all that good stuff. Greatly appreciate it. Join the Discord, it's free. You can go to phmillennial.com/join. Definitely trying to build out more of a community there, get people talking more about public health, global health, everything in between. But I enjoy this episode a lot. I love his perspective on global health, how he got involved in global health, as well as just how active he was during his undergrad degree. And hopefully I'm going to try to get some more people with undergrad degrees only as guests to share more about their perspectives, because I think they're doing great work as well as people with like MPHs, DRPHs, etc. But I enjoyed how he shared the perspective of when he went to Zambia and thinking about not mopping up the puddle, but fixing the tap, I think is what he said. That is a great perspective and I think is important, especially for us in public health. So enjoy today's episode. Today, we have a multifaceted global health professional working to improve fragile health systems in low-income countries. He got his bachelor's degree in neuroscience at Dartmouth College. He was a global health fellow, great issues scholar, as well as participated in Dartmouth's Global Health Policy Lab, while also working as an EMT and volunteering with the local search and rescue team. He currently works as a partnership and research coordinator at Build Health International. We have Pedro Miguel Castro. Welcome to the show.
Hi, Mari. Thanks so much for having me. I've actually listened to a whole bunch of podcasts and learned a lot from your past guests. So I'm really honored to be a part of the show.
Well, I'm really happy to have you, and it is always a pleasure to hear that someone listens to the podcast and that they take away good insights from it. And now you get your chance to share, and I'm looking forward to hearing all the great insights that you have to share as well. So, how are you doing, and how have you been coping during this time?
I'm doing well, thanks. Yeah, everything's going well. I'm actually, as you can see, I'm wearing a sweater. So while we're trying to deal with this heat wave, it's actually super cold in the office right now. So that's fun. But otherwise, everything's great.
Well, that's good. And yeah, I could imagine. It was interesting because I was traveling in Atlanta yesterday, and everyone on the MARTA trains were wearing sweatshirts, and I'm like, "What do you guys do? It's so hot outside. I don't know how you."
Right? Yeah.
But fair enough that you're inside a cool building, and I feel like people they don't understand, like when it's hot outside, you don't have to make it as cool inside.
Right. Exactly.
Yeah. But regardless, I'm glad you're doing well. So tell me, how do you identify, and then tell us a little bit about your personal background?
Sure. So my name is Pedro Miguel Castro. My pronouns are he, him, his. So my personal background, my parents came to the US from Brazil in 1998, and I was born and raised in the greater Boston area. I live in Stoneham right now, and so I went to the Stoneham public schools until high school when I went to Austin Prep in Reading, Massachusetts. After that, I attended Dartmouth College, where I graduated last June, I guess, with a bachelor's degree in neuroscience. And right now I'm working for a global health nonprofit called Build Health International as their partnership and research coordinator. And then on like a more personal note, my free time, I love being outdoors. And so I've spent a lot of time, especially now hiking, fly fishing and doing bird photography.
Okay, that's awesome. That's awesome. And are there quite a few hikes out in Boston area? I'm not too sure.
Yeah, in the Boston area, there's the Blue Hills reservation, like South Boston. But I usually head up into New Hampshire and Vermont to do my hiking.
Okay, that's awesome. Well, I'll definitely have to add that to my list sometime, and maybe we can get out and hike together at some point as well.
Absolutely, yeah, that'd be
Yeah,
great.
that's awesome. And how'd you get into bird watching?
So that's a funny story. So at Dartmouth, I lived in a Greek house, Phi and the room that I was in had a window that faced the tree. And at some point, I just decided to put a bird feeder up there. And I saw so many different kinds of birds that I'd never seen, living in Stoneham, that I decided I'd buy some binoculars, and I just got super into it. And that eventually kind of led into, I always really enjoyed photography. So eventually, I bought myself a camera, bought myself a telephoto lens, and like here we are, and I've just found a lot of pleasure in the curiosity, just watching the birds and seeing how they interact and how they live. Yeah.
Okay, that's awesome. That's awesome. Yeah, I did a class on birds ornithology. Is it? Yeah, that's ornithology, study of
Yeah, yeah.
birds. Yeah, I did a class in my undergrad, so definitely got to learn a lot more about birds. Had to like remember the sounds of different birds and like
Yeah,
get
yeah.
tested on that, which was crazy, but definitely a cool experience. And I feel like it's always awesome when you can pick up hobbies that get you outdoor and get you like active and like just learning about things that might be necessarily related to the work that you're doing. So that's awesome.
Absolutely, yeah.
Yeah. Okay. So before we get into your collegiate experience as well as a job that you had prior to that, what does public health mean to you?
So it's a hard question because I feel like it's always changing. I think the short answer for me though is that public health is kind of ensuring that everyone has access to the resources and the knowledge they need to live a healthy life, right? I'm especially passionate about working to address health disparities, and so like as I mentioned before, I'm the son of Brazilian immigrants. But the very reason I'm here in the U.S. is because of a lack of access to health resources. Early on, my mom was told that I was likely going to be born with Down syndrome. And at the time, my parents were having financial difficulties, and they knew they wouldn't be able to access the healthcare and educational resources they thought I might need in order to have a good life in Brazil. So they came to the conclusion that the best opportunity I would have would be in the U.S. And so, moving forward a little bit, later on in my childhood, I was told about a cousin who had died after getting an ear infection, and he didn't have enough money to pay for the medications and treatment early on, and had to wait for an appointment at like this state-sponsored health post. But by the time he was seen and referred to a higher level of care, the infection already progressed beyond the ear, and he died before even making it to the hospital. And so at the time, I remember being like so disgusted by the fact that money could be the difference between life and death in a lot of places. I couldn't believe that people were still dying of something I knew to be easily treated with modern medicine. Like I grew up with chronic ear infections and even had to get like tubes in it when I was really young. So at the time, I couldn't understand, I couldn't fathom how something I'd been treated for multiple times in my life could be so hard to treat there, and could kill a member of my own family. And so reflecting on those episodes in my own family history, in high school, like it kind of placed this fire with me to pursue medicine and global health in order to do my part in addressing the barriers to healthcare that people in low income communities routinely face. So what does public health mean to me right now? It's about working to ensure that everybody has equitable access to high quality healthcare.
Yeah, and I love the part of you saying that the definition of public health changes, because I think that is so true, especially on like experiences and things that we have to learn. We we view public health in a different lens every time we get new experiences and different things like that. And
Absolutely,
I'm really sorry and disheartening to hear about your family and the inequitable access to healthcare and access to healthcare in different countries is just so varied. And I'm glad that you're doing the work now to prevent other types of things like that happening in the future, and giving people more access in the global health landscape, which I think is important. And I'm just glad that you were able to highlight that, and hopefully that we're able to continue to work towards better access for everyone around the world as well. So before you got to undergraduate at Dartmouth College, you were a program assistant at the Museum of Science. So tell me, how do you get involved in that, and then what do you do?
Sure. So that really began with a friend of mine who was she was actually applying for a volunteer position at the museum, and I grew up loving the Museum of Science in Boston. I love science, and so the Museum of Science was truly one of my favorite places in the world. She was saying how she was going to apply to volunteer there, and so I asked how I could as well. And I applied. I managed to get the position, and I started working as a volunteer exhibit interpreter for the Hall of Human Life. And that essentially means that my job was to help communicate and teach biology to the public. So it was everyone from we 5-year-olds to senior citizens with every level of education between them. And it was such a great time. The position taught me so much about science communication, and really instilled in me this deep love of learning that I think you can only really achieve when you learn to not be afraid of being honest with yourself and other people really too, and saying I don't know. I think once you allow yourself that freedom to be open with that, that's when you can really start to learn deeply, right? And so I had already learned, rather, I already love science, and this job made me fall even more in love with biology. And so that was the volunteer position. Later that summer, I actually found out that there was a program assistant position within the department. And so I applied to that and ended up getting it. And so that essentially meant that I'd be coordinating the volunteers, training them, and doing other behind the scenes tasks to keep the department up and running. And again, that was even more incredible because I was further behind the curtain. I could see what it really took to keep everything running, and it was incredible. I think another reason why I enjoyed it so much too was because it gave me a lot of opportunities to develop professionally. And so one of those experiences, or one of those opportunities, was to go to the brain bank. And there I got to shadow the neuropathologists, and at one point I even got to hold a real human brain. And that was a moment that still really gets me, because holding this brain, I got between my hands lay this great big beautiful organ that was very literally everything this person once was, and all their hopes and dreams, their memories, their triumphs and failures. This person's very being rested in my hands, and it hit me hard and created this kind of fascination with the brain that I took to college and culminated with my degree in neuroscience. Yeah.
Okay. Yeah, that's awesome. And I can only imagine that feeling of being able to hold the brain and then say wow, this is amazing. What can I learn more about this? And I feel like going back to, you came into this as a volunteer. And I wanted to highlight also, shout out to you for networking, seeing that your friend was volunteering, and then being able to also volunteer, and then moving on to a program assistant role, and learning the importance of not only sharing what you know with people, but when they ask questions that you don't know, saying that you don't know. And then from there, you might be I don't know, but I'll find out. And then just digging deeper into it, but being honest with yourself, which is awesome. But I'm glad that you got that experience. And I imagine that is very formative in you wanting to pursue neuroscience and going into college. So that is awesome that you were able to get that experience early on. And talking about neuroscience, so you got your Bachelor's of Arts in Neuroscience at Dartmouth College. So did you go in to Dartmouth College wanting to study neuroscience, or what was your thought process going into this degree?
Yeah, so that experience at the museum was really a formative one for me. I guess in high school, I already kind of knew that I wanted to go into medicine, but I didn't really I guess I grew up learning, I grew up knowing that I wanted to go into medicine, but I guess for me that the way that took place was by going to college, studying biology, and then applying to med school after. So when I was initially looking at colleges and thinking about what I was going to do, I was thinking biology, but it was this experience at the museum that really, changed some of that, and it was like it created this fire to want to learn more about the brain and to kind of dive deeper into all the nooks and crannies, that are associated with the field. I guess when I went into Dartmouth, I kind of had an inkling that I did want to study neuroscience. And on top of just the sheer curiosity I had for the brain, I also thought that it would be a good balance. Like I'd be able to focus more on the human body, and that was really what I was interested in wanting to pursue medicine later. Than biology would allow me. So yeah.
Okay, and I like that. I like that you're saying that you want to go into medical school, and I feel so many people say they want to go into medical school and then go and get a biology degree, and I feel like medical schools these days are looking for people that don't have a biology degree or have like the biology experience, the lab experience, the hours and stuff like that, but also have other varied knowledge. Like granted, neuroscience very particular, very like brain heavy, biology heavy, I'm guessing, but more specific than just like a biology degree, which I think is going to be very helpful for yourself as you plan to pursue medicine, as I think that is your plan. Granted, we love
That's
you.
right.
We love you in public health. We love you in global health. I'll continue to say that, but granted, I think regardless, you're gonna have a varied perspective, like going into medicine with a public health, global health background, which I think is a beautiful thing. And I think more doctors should have that type of experience and learning. Okay, so you had a lot of different things that you got involved with during Dartmouth. So we're going to go through quite a couple of them. And I look forward to hearing well, I guess before we get into all of those, like going into university, were you someone who was like, I'm gonna take up the most amount of experiences and learn the most amount of things, or what was your perspective? Because I have a lot of different things that you were involved in during your undergrad career.
Yeah, that's right. In high school, I also did a lot of different things. I come to realize that one of my favorite hobbies is collecting more hobbies. And in high school, I was in the jazz band. I did a lot of volunteering. I was a big fencer, and I was the president of several clubs. Astronomy and sci-fi fantasy club, which was a great time. I just really loved learning new skills and getting into different things. At some point, I started getting into like astrophotography. Yeah, and so I guess going into college, I already had that kind of love for just learning new skills and developing that new knowledge. And it certainly did keep going into college, as you know.
Okay, that makes sense. And like having an appetite and getting the experience to do all these varied things throughout high school, as well as like doing the Museum of Science, I'm guessing it's like, oh, there's so much that I can learn, that I can do. And I think that's the onus that we should all have early on in our career, especially in our collegiate career. Like how can we gain more knowledge, gain more experiences, and just do new things that are pushing us beyond the bounds of what we know and what makes us comfortable. And I'm glad that we get to highlight quite a few of your roles. Okay, so the first one is a research and development intern at Build Health International, and this is a role. Well, this is a company that you currently work for, but this is the internship before your current role. So tell me how you get involved in this. How do you find out about this internship, and then what did you do as a research and development intern?
Yeah, sure. So it was in 2019 that I first interned for BHI. Or rather, let me start by giving you like some context on what BHI is. So Build Health International is this it's a global health nonprofit focused on working with like partner organizations and local workforces to build sustainable, high quality healthcare infrastructure that provides access to dignified and affordable healthcare in vulnerable communities like around the world. So since being founded in 2014, BHI has worked on over 200 products across 28 countries. And even since the pandemic began, that's grown even larger because now we're heavily involved in working to expand access to medical oxygen throughout the world, really. But yeah, like you said, I started off as an intern and I stayed on later in college as a contractor. And I feel super lucky to have gotten that internship at VHI to begin with, because at Dartmouth, we have this scheduling system that leaves us with a few terms where we're supposed to be off campus taking internships and whatnot. And my initial plan actually fell through at the last possible moment. I freaked out and sent an email to one of the professors I'd become close to through the Great Issue Scholars and Global Health Fellows programs at Dartmouth. And so I explained the situation, asked if she knew of any companies in the global health field that were still accepting like interns, right? She ended up connecting me to people at BHI. I sent in my resume, had my interview, and I ended up getting the internship. And so every time I talk about it, I'm always kind of in shock about like how close I came to missing out on BHI when it's become such a big part of my life. I work to prepare program and study reports. I helped do these project proposals and presentations. I did so many lit reviews on a whole range of clinical delivery topics, and I wrote papers on like the built environment and healthcare landscape of product sites. And I even did some special products like in the realm of website management and content development. That internship was really, really cool too, because I even got the chance to work on the ground in Zambia for a project that we were doing. And that trip really cemented the idea that for a product to be sustainable and truly helpful, it's imperative that we work in close partnership with the people we're trying to help, and really truly listen to what they're saying instead of thinking we know better. I think that's something that's kind of rampant in international development, in global health. We're taking steps to get past that, but it certainly was part of the history. And I think it was really great as a student to see the differences in the situation as it was on paper versus in country.
Yeah, I can imagine doing a lit review and then going to a country, completely two different things. As you said, getting the experience of people, knowing how to work with community is important. And I've done a little bit of research on BHI, and they are doing great work. And I know that we'll talk a little bit more about your current role with them a little later on, and some more about that. But also, shout out to you for like reaching out to your professor and seeing what opportunities you can have and getting that like warm handoff, as well as like probably also doing well in your interview and getting hired. And I think that's something people underutilize, like just reaching out to professors and seeing what kind of connections they have. Because look at that, there's an internship, then you turn into a contract, and it turn into a full-time role for you, which I think is onus on you for like taking the steps to do that. And also highlighting that you said that role that you wanted fell through, and I think like at that point in time it's probably like, oh crap, what am I going to do? But like in hindsight, it's like thankful you I don't know, but I'm going to guess that you're thankful that it fell through, so that you're able to get this opportunity that has come with so much other opportunities and learning throughout your life.
Yeah, 100%. Like I can't imagine what my life would have been like if that didn't fall through, and if I didn't get involved with BHI. I've learned so much here, and it's just become such a big part of my life that I really can't. I'm super grateful for for the fact that fell through.
Yeah, and I think that's a key for anyone listening out there that might be thinking that they're a failure or they didn't get through the position. That's just a part of your journey, and just when one door closes, many open, and just keep on looking for those opportunities because they're out there. as we heard Pedro, like reach out to people when those opportunities do fall through, because people are looking to help you and support you, especially as students. People are always trying to help you as best as can, especially if you're a good student. So be a good student as well, and then reach out for those
Right.
opportunities. Okay, so you're also part of Dartmouth EMS, and while you were in Dartmouth EMS, you had quite a few roles. So you were equipment officer, a QA, QI improvement officer. I'm guessing that's quality assurance, quality improvement officer. Then you were WEMT, and then a professional development officer. So how'd you get involved with EMS? And then tell me about, I guess, the journey throughout your time as a Dartmouth EMS person.
In high school, I knew that I wanted to pursue medicine. And it was something that I've always been interested in, and I've always really loved helping people. And so going to into Dartmouth, during my first term there, we had a big activities fair, and I came across the Dartmouth EMS booth. And while I was there, I learned that it was this student-run group that provided basic life support care for the community, like in Hanover, really, the immediate Dartmouth community, but then also a little bit into town. And I thought that was super cool. I love the fact that as a student, I could still, I could provide care for people right now. I didn't have to wait until medical school to be able to start doing that kind of work. And so, I was super interested. I applied. I ended up getting in. But at the time, I actually still wasn't in EMT. They take us a good number of people each year who aren't EMTs, and I guess the understanding is that you're being accepted, and if you don't want to, you don't actually ever have to become an EMT. But they hope that you'll take a class, become an EMT, and be able to rise through the ranks. And so if you're not an EMT, you get stuck as a tertiary. Once you get your EMT license and you get a few calls, you can be promoted to secondary. There's a halfway rank we call it transition phase secondary, which is when you. Sorry, let me explain. So as a tertiary, you actually you're essentially a scribe with the squad. And so you go to calls just like the rest of the EMTs, but you don't do any hands-on patient care. You're watching and watching, learning, but then also taking notes for the run form. That being said, you do have to get your first aid and CPR certification. So if there's something that would fall into that realm, we would ask for tertiary help. As a secondary, you've already got some experience, but it's still kind of you're not a squad leader yet, and so in that role you'd be taking lots and lots of vitals, and you'd be giving input to the primary, which is a squad leader. They run the shift, they organize everything, and they're doing they're the primary caregiver in the scene. Yeah, and so the transition phase secondary that I was mentioning before is kind of the halfway point where you're giving some of the responsibilities of a primary, but not all of them, just so that it's an easier transition. So that was that. I ended up taking my EMT course at Dartmouth. Became a wilderness EMT, and I kept going with that all four years. And then, like you said, I also held a number of different positions in the organization. So during my first year, I signed up to be I was elected to be the equipment officer. And so for that position, I was ultimately responsible for all the team equipment. I determined what equipment we needed, made purchases, managed and maintained our inventory, ensured distribution, and I was also in charge of maintaining our car and working with our community training officers to meet the equipment needs for the CPR and first aid class. I actually held up for 2 years, and it was in my junior year that I became the QA/QI officer. And again, that's quality assurance, quality improvement. And that was one of my favorite jobs, to be honest. through that job, I had to review the calls we had throughout the week, determine personnel rank, and ensure that we kept a high standard of care. Another part of my responsibility was to organize a committee that consisted of the director of training and director of operations, facilitating discussion and giving feedback on the calls that our providers had during the week. And so essentially, at the end, I'd be giving pointers or tips, remediation where needed to kind of make sure we keep that high level of care throughout. So that was my junior year job with Dartmouth EMS. And then senior year, I became the professional development officer. And that was also really cool because it was more of a relaxed position where I got to hold office hours each week and schedule time with anybody who wanted to further develop their skills. And we'd practice, and I give them tips and tricks. And overall, the goal here was just to make them more confident and be a more competent care provider and get them promoted within the organization. But yeah, no, Dartmouth EMS was definitely one of my favorite parts of Dartmouth. It was really, really great to be able to give back to people, to give back to my friends, really.
And I like everything you're saying there. And I especially like the part of you saying, like, not waiting to be able to help people. You saw an opportunity where you're able to help people and you actively engage with it, and were able to get so many varied experiences through that, like, one opportunity and like one viewpoint of, okay, let me try to get some experience actually helping people. And I'm guessing that also informed, okay, this is something that I like doing, and I'm learning about this specific parts of it. They're all the other parts of like medical care that are there. So that's awesome to you, and like kudos for you to like for taking that up, because I know many people try to just kind of be comfortable and don't do anything, but that's not you for sure.
I definitely try and put myself in situations where I can kind of, I'll be a little uncomfortable and grow more, get new skills. Yeah, thank you.
Yeah, I think that kind of goes back to at the museum saying, yeah, I don't know, but I'm guessing that I don't know is I don't know, but I will learn. So next time someone asks me this,
exactly.
And I just cultivated that ethos of like learning and wanting to learn, and I think that's awesome in itself. And you're also a global health fellow during your time at Dartmouth College. So tell me about that.
Yeah, so the Global Health Fellows program, so it's a second year program where you essentially get to be connected to this group of like faculty, students, and then global health partners around the world to discuss how individuals, groups, and institutions can address these complex global health challenges, and especially in the areas of like health and wellness, human rights, health security, planetary health, and like diplomacy. And it really was an amazing program because you just got to hear from all these like heads of the field. And learn about these different topics that you wouldn't necessarily get from your classes. It was really broad and exposed you to, I guess, it was broad in that it covered a lot of areas, but you also got to see some really niche like programs and areas of expertise that each person brought.
Yeah, and I think that also goes to like the multi-sector learning that you're getting from that, like being in a space where you're learning from varied professionals who have different expertise coming together and sharing information, which I think is something that undergrad or sometimes doesn't get the best. But shout out to Dartmouth College and the Global Health Fellowship Program, because that definitely was something that I like listening to you talk about. It is something that you're able to get in there as well.
For sure, and it was just really cool being able to see the different paths that people took and the different ways that global health manifested. It wasn't just, practice medicine, do it globally. It was really, for example, something that I never forgot was how like climate change, affects mental health, and how, especially in like the Arctic among native populations. It was really eye-opening to see how it, it really does become planetary health, where we have these effects on the planet, and it ends up coming back to us, and usually more vulnerable populations than those who are actually responsible for creating, all the pollution.
Absolutely correct. And yeah, climate change is a real thing. As we see like all the fires in Europe, and I'm
Right.
guessing that they're going to be a bunch of fires in California at some point in time as well. And yeah, we need to take action on that. But I guess this isn't a conversation about that, because I feel like we could talk about that
For
and
sure. Yeah.
for a very long time. But we need people to talk to their representatives and get them to pass more policies around climate change, because the world is going to be suffering a lot if we don't do something soon.
Yeah.
Yeah. And then, like, talking about you being a learner and wanting to learn, you are a great issues scholar. So tell me, what is a great issues scholar about?
Yeah, so that's a first year program, and you apply and it complements your academic experience during the first year, just like the Global Health Fellowship. And so this one is especially cool because during your first year, you actually live in the same building as other people in your program. And so in my case, like all the people in my program are on the same floor as me, and you really just got to live and breathe with this diverse group of people from all over the world, and you attend presentations, discussions. We had this cool simulation, global security. It covers a whole range of topics, and so it covered global health, but also climate change, gender and politics, international development, and regional security. You just went, yeah, it was really great because you got to again learn about various academic and career paths and show how rich our experiences and cultures are, and the variety of perspectives that each person brought to the table.
Yeah, and I think that's so important. You just putting yourself into rooms where you're like getting new experiences, learning about different roles. Because as we know, there's just so many different roles, whether that's in public health or global health,
Yeah,
that people can go into. And like being exposed, I think, is the first step to really understanding where you fit in that. And I think like Dartmouth College seem to have given you a lot of opportunities for exposure and new exposure to a lot of varied topics, which I think is important, especially as an undergraduate student. So shout out to them. And you're also part of Dartmouth's Global Health Policy Lab. So what once and again another thing that Dartmouth College did well. So tell me a little bit about that.
so the Global Health Policy Lab is a two-term program essentially where it counts as one of your classes, and you and another cohort of Dartmouth students engage in team-based projects with like in partnership with ministries of health and NGOs and community partners, and in resource constrained settings. And so my year, me and two other people were involved in a telehealth project in Peru, and so we got to engage with the ministry, and we did a whole bunch of lots of conversations with the ministry, and we got to go on this field trip to this big telehealth hub up in New Hampshire, and just explore that a lot. The first portion of the program was essentially building a literature review, and then with the intent of creating a white paper on telehealth in the following term, where you would actually go to Peru and see what it was like there, and trying to help the ministry, or rather, and be involved in the ministry's attempts to pass global health policy, or sorry, just to pass telehealth policy. It was an amazing opportunity, and really got to learn more about methodology, and how to actually like interact and do these like population-based like science in real life, how it's actually done. Yeah.
That's very fascinating. And you have a lot of work around global health throughout your undergrad degree. And I guess I had two questions, and one might answer the other one. So as you said earlier, you were research and development intern at BHI. So question there is, when was that during your undergrad degree? And then the next question is, when were you exposed to global health? And then I guess wanting to dive more into that.
Yeah. So I guess global health was sort of something that I've been wanting to do, since I wanted to pursue medicine. with my family background, I knew that I wanted to focus on like low-income communities and underserved populations. And, my immediate thought was, oh, I want to do work in Brazil. And so that's sort of how I came into Dartmouth thinking. And then through Great Issue Scholars, which is the first program I got into, that really showed me that, oh yeah, this thing is called global health. And that's kind of how, that's the area that I want to focus within for medicine. The other thing too is that in high school, during when I took a social ethics and morality class, and in that class I got exposed to Dr. Paul Farmer through Tracy Kidder's Mountains Beyond Mountains, and Dr. Farmer really opened my eyes to the great injustices of the world and to just the structural violence and and the inequity that so many people face. And that's, again, with the background that I had, he really spoke to me, and he became he became my great hero in life and someone I really looked up to. So I just kind of started pursuing that like a sidebar. But at the Museum of Science, he was actually accepting an award there, and I didn't even know about that. I was just working when I saw this poster up saying that he was going to come to the museum on this day, and I got super excited. And so I decided that I was going to do everything I could to kind of get in there and be able to hear him talk. And I talked to my bosses, and they actually they let me, or they found a way of getting me onto the catering staff to work the event. And so I worked for the first bit, and then afterwards, once we were done, I was able to sit down and listen to him speak and accept the award, and it was really great. And especially the end where I actually got to walk up to him and meet him in person. But yeah, Dr. Farm was really a big inspiration for me going into things. And during my first year at Dartmouth, I kind of followed that, keeping him in mind, and got into the Great Issue Scholars program, and then Global Health Fellows my sophomore year. It was winter of my sophomore year when I did my internship at BHI. And then immediately after that, I got some great recommendations from Jim and David, the co-founders, and the co-founders of BHI. And with that, I was able to get into the Dartmouth Global Health Policy Lab. Yeah, and that's sort of where that spewed out from.
Yeah, I appreciate you sharing that. That definitely is helpful, and like you explaining how that all worked out. And I think it's just layers on layers on layers. And once again, I want to shout out yourself for like making sure that you got yourself in the room when Paul Farmer was presenting, like being catering staff for one half of the event, and then just being able to sit down and listen to him, as well as being able to meet him. I could only imagine what that does for like inspiration and wanting to pursue this. And then, as you said, that led into the Great Issue Scholars, and from there, global health just kept being a theme in your career. So that's awesome. Yeah, and the last role that I have here for you during undergrad was you were a volunteer at the local search and rescue team. So tell me, how'd you get involved in that?
So it was one of the guys on my on Dartmouth EMS was already involved in it, and I learned of the organization through him. But yeah, it's called the Upper Valley Wilderness Response Team, and it's a rapid response volunteer search and rescue team working with state authorities. So that's like New Hampshire Fish and Game, Vermont State Police, all that, and we search for missing persons in Vermont, New Hampshire, really. It was originally a program that was affiliated with Dartmouth's Geisel School of Medicine, but when I joined in 2019 and become a nonprofit, like separate from Dartmouth, yeah, and it was an incredible experience. It really was one of those things where you were putting yourself in uncomfortable positions all the time, and I would get pages in the middle of the night and have to run out in the pouring rain to bushwhack like 5 miles in the woods. It was uncomfortable. You also you in the back of your mind that someone else is more uncomfortable than you are, that you have this support team and you have this, I on my back, I'm carrying a pack that has enough gear in it for me to survive 24 hours if I need to. But this person is very much, alone, and they don't know where they are. They're very, very afraid. And so you kind of go out with that mindset, and you know that you're out there for something bigger than yourself, and I think that's also something that I really loved, and that everyone that was with you also shared that mindset, and also, was recognized that this is someone's worst day, and you had the privilege of being comfortable and safe enough to do something about it.
Yeah, that's very commendable, and I think that's a great perspective to have, 'cause especially when we're dealing with things, whether that's in medicine or in public health, the populations that we're dealing with, they are typically going through a bad time, and we just being able to show up for them and acknowledge that, like, whatever privilege that we have at that point in time is acknowledging the privilege, and then using that and our knowledge and experience to be able to help them, I think is really, really something that's commendable, and what I really do enjoy about a lot of the work that we get to do. But I like how you frame that, and yeah, it's always good when you have like a team of people who have the same sort of mindset, knowing that
Yeah.
they're doing this for a bigger cause. They're doing this for someone that is lost and scared and might be cold or whatever the case might be. So that's really commendable on you all as well.
Thank you. Yeah, I think as as a group, we all, I don't know, I think it really just builds up the faith in humanity when you see that kind of thing.
Yeah, that is true. That is true. And then before we get into your current role as BHI, did you have any other takeaways from undergrad experience that you wanted to share with us?
Yeah, so I said all those things, and Dartmouth taught me so much. It was such an interesting time. I gained so many new skills and friends from all over the world, and people I call family. Um, Again, I got into. I'm the type of person who loves getting into different hobbies and learning skills, and so on top of the things we mentioned, I was also on the Dartmouth College marching band. Uh, I joined our competitive timber sports team, the competitive lumberjacking, and I even did weekly Argentine tango classes. So I love doing more things, but and Dartmouth was really great for giving me that knowledge and giving me the skills and whatnot to put me where I'm now. But at the same time, it was also really difficult for me because it was the first time I came to head with my ADHD. Like I mentioned a little earlier, I had a super regimented schedule in high school. I had jazz band practice in the morning. I took my classes, and then I went to fencing practice, did volunteering. And so when I got home, I knew that I only had a few hours to get my work done before going to bed. And that kind of strict schedule really kept me on track and gave me the impetus to get everything done. So in high school as a straight A student, president of a whole bunch of clubs. Getting to Dartmouth, I suddenly had to grapple with this like increased demand on my executive function skills, and it was actually the first term that I realized that I had ADHD. All three of my professors came up to me after class, and they talked about how I was having trouble meeting deadlines and finishing exams, and they recommended that I see the Student Accessibility Service office. And I went and talked to them. They did this triage, and eventually I got paired with a clinical psychologist, and he officially diagnosed me with ADHD, specifically the inattentive type. And it was really interesting because it gave me a lot of perspective on like other things in my life, and especially going back. In high school, I always took longer to finish exams, and I always felt like it took me double the time it took other people to finish work in general. But at Dartmouth, my first and second years were pretty tough because it felt like I was essentially learning to learn again. the study skills I had been able to get away with in high school, some of them weren't cutting it. And it was really disappointing because I had these aspirations for college and what I was going to be learning, and how I was going to, I was super excited to be excelling in my classes, and it just felt like that wasn't happening. And so by junior year, it got really, really hard for me, and I ended up becoming like depressed over my performance. And I knew that I was capable of doing much more, but it's just that I had this different relationship with time than my peers. And if I could just do things on my own schedule, I could absolutely achieve what I knew I was capable of. Yeah, it was hard. But then, I started tuning up how I was going about certain things, and senior year ended up being um, my it ended up being my best year. I had a hard look at myself, and how I was going about doing things, and realized that things need to change, perspectives need to change. And so on top of all the knowledge and skills and family that Dartmouth gave me, I think the best thing it provided me was this resiliency and deeper determination to achieve my goals. Now, I won't be a traditional applicant to medical school, but I think the perspective, the humility, and the drive, resiliency, and passion that I was able to get from Dartmouth are things that will make me a great doctor in the future.
Yeah, absolutely. Thanks for sharing that. I know that probably was a tough thing to acknowledge in your life and to go through, and I appreciate you sharing it. Hopefully it helps someone else who might be thinking that I'm taking longer than everyone else to go through exams and stuff like that, to let them go get checked to see if this is something that they're dealing with, and to and at that to that point, find ways to become more resilient, or to find techniques that are able to help them to just get through what they have to get through at this point in time. But I appreciate you sharing that, because that I think will be helpful to someone in the future. So shout out to you for that.
Yeah, no, absolutely. I think one of the best things that I've done in trying to learn who I am, learn how my brain works is, and honestly, just feeling validated is listening to other people tell their stories. So it's that sort of thing where you're like, oh my gosh, that's exactly how I feel, and I'm not alone.
Yeah, and that's the importance of sharing our stories and being authentic about them, and
Right.
giving people, because as you know, we aren't the only ones going through, we go through similar situations a lot of the times, and to know that there are others that are going through it could be very comforting and can help you to maybe find community or just find solutions to working forward. So thank you for that. And then you graduated and you became a partnership and research coordinator at Build Health International, or BHI, as you say. But before we get to the position that you have right now, you said that you were contracted with BHI. So when did that happen? And then tell me about the contract, and then shifting into this position as a partnership and research coordinator.
Right. So right after, when my internship was ending, according to Jim and David, they didn't want me to leave, and so instead they agreed that I'd stay on as a contractor, and essentially I do small projects whenever I could, and this is all during the school year. At the time, I think I was able to get a couple projects done, but because of school and stuff, I wasn't able to do as many as I wanted to. And especially because that ended up being a really rough year for me. But moving forward, as I was approaching graduation, Jim reaches out to me again, and he essentially just asked if I wanted to work for BHI full time. So I ended up accepting, and here we are.
Yeah, shout out to them for saying, hey, we want this guy and he's doing great work. Let's keep him around. We need more people like that in this world who see qualified people that are doing great work and say, okay, let's do what we have to do to keep them and retain them. So shout out to them for that.
Yeah, I'm infinitely grateful to Jim and David for being my mentors, really, and for being this enormous inspiration for me, and for keeping me on.
Yeah. That's awesome. And then, so what do you do in your role as a partnership and research coordinator?
So right now I work as BHI's partnership and research coordinator, and so that means I'm involved in managing. So like on one hand, I'm managing the stewardship process for BHI and researching potential donors and partners and working with different like project managers to monitor and produce reports on BHI's health environmental sectors. I also partner with organizations like PATH, like more on the research side of things, organizations like PATH and Partners in Health, the Gates Foundation, just to name a few. And then I help do research to produce papers on global health infrastructure and policy. And so, like, kind of touching on that, right now I'm working on a paper with PATH, which is a nonprofit that partners with like a global health PATH is a nonprofit that partners a global team of innovators with organizations in order to accelerate health equity by developing innovations that remove barriers to health. Specifically in this paper, we're working on advocating for greater adoption of medical oxygen pipeline systems in low and middle income countries. So I'm sure we're all familiar with at this point, COVID placed this like huge demand on medical oxygen. And there were shortages around the world. And COVID really showed everyone how fragile the oxygen like ecosystem was. But at the same time, this was also known for a while, and that like pneumonia and lower respiratory tract infections were ranking among the top 5 leaders of under 5 mortality for decades. And every year, even hypoxia leads to many thousands of preventable deaths, right, each year. In this paper, we're trying to advocate for greater adoption of piped medical gas over just using cylinders, because we believe that really does have an impact on patient outcomes. In the U.S. and other high income countries, where that really is the standard for hospitals. I don't think I've ever seen a hospital where we didn't have gas coming out of the outlets by the bedside. Especially in sub-Saharan Africa, where we're focusing right now. Rather, putting in these systems requires a lot of like capital and resources, and so we're hoping that through this paper we can show that there are alternatives, and we're trying to show that there are ways of setting these systems up in low resource settings, and encouraging people to get behind this idea and help establish those the supply chains and really increase access to medical oxygen. So that's one of the projects. Another project I'm working on is developing this training program for biomedical technicians on how to operate and take full advantage of oxygen generation plants that supply the oxygen for these pipe systems. With COVID, we started doing these find and fix products where we're actually involved with this like whole coalition of different nonprofits and organizations that have been involved in trying to increase medical oxygen. And our find and fix programs is very much what the name implies. We've been trying to find places where there are medical oxygen plants, and fix them so that they start actually generating oxygen. One of my coworkers, Michael Gonzalez, recently told me about how he was assessing a plant that had been installed for over a year. And when he arrived, the plant looked like it was in mint condition, never been used. And that's because it was. The people that donated the plant, installed it, patted themselves on the back, and kind of left without actually showing the staff how to use it. And so there's this disconnect between providing the infrastructure and then actually giving people the ability to use it. And so we're hoping to be able to address this issue by coming up with this training program that we can give to our partners in country and make sure that when we go in, we fix these oxygen plants, that they're actually able to take full advantage of them and provide the oxygen.
Okay, that's awesome, and I like that you highlight highlighted that part there. It's like they install this oxygen pipeline and it's in mint condition, and that's because no one used it, because no one taught them how to use it, because they just kind of came in and did it, which I think you alluded to in the beginning, when you're talking about your internship. It was like BHI is really trying to do community driven work in these countries and really help them with figuring out how to best install this type of infrastructure to ensure that they are reducing inequities and giving them the best access to this type of technology and, I guess, medical devices that are
Right.
helpful to their populations, which I think is truly amazing.
Yeah, and that's something that I really love about BHI. I think there's such an emphasis on sustainability and looking to the future. We're really trying to run ourselves out of business here, where we hope we don't need to keep fixing them because they're already fixed. And the sustainability comes from making sure that the communities we're trying to help don't need us, in the future, that we're able to provide them with the resources. They can use the resources and they can, go on without needing anybody else, really. I just think it's a very important aspect of international development and global health that is sometimes overlooked. Especially now with climate change, and we really need to be looking towards sustainability and just being able to make sure the products we're doing today are able to last for a long time, and that they actually mean something, that they won't be something that in a year's time will be abandoned.
Yeah, and I think that perspective is important, and I'm glad that there are organizations like BHI that are sharing that perspective and knowing that we're doing this great work, but the hope here is to do this great work, teach people how to operate these systems so that we as an organization don't have to exist. And I think that's hard in a lot of spaces for organizations and people to grasp that perspective, instead of just wanting to continue to put their help and do this work. Granted, a lot of the time it is needed, and sustainability in itself takes like a long time, but just having the perspective that that is the end goal is, I think, is important when you are starting off and doing any of this type of work, especially in more impoverished countries.
Right.
Yeah. Okay.
Yeah.
Okay.
And that, like, it also just reminds me, I had this really great, I mentioned a little earlier, but during my internship, I had this really great opportunity to go to Zambia. We were BHI was working on a NICU, a neonatal intensive care unit there. At the time, Zambia had a really high neonatal mortality rate, and so we're going to try and fix, or rather, we're trying to improve the NICU at the University Teaching Hospital in Lusaka, which was the biggest hospital in the country. And my boss and I were at a meeting with the provincial director of health to discuss which clinics we should visit to kind of gain an accurate picture of the situation there. And while we were there, one of the two pediatricians in the district began to tell us how this isn't just, it's not just the state of infrastructure that we need to worry about. By rebuilding the NICU there, we're just addressing a symptom of the disease and not the root of it. He said, and it stuck in my mind, that it's better to fix the tap than to mop the floor. And that was kind of a phrase that stuck with me because, in this case, the neonatal mortality rate wasn't a problem that was isolated to the hospital. It was a problem with like the roots, and it was a problem with roots in every level of care beneath that too. Neonates were dying or having to live with significant disability because they were being referred to the hospital. And I understand the situation based on what they told me was that it took so long for the moms to arrive at the proper level of care that the neonates were suffering from hypoxia, and the NICU became more focused on salvaging their brain function than anything else. And sepsis and hypoxic ischemic encephalopathy were the two main killers of neonates there. But they could be addressed through a greater focus on primary care and training midwives to recognize, that this is a situation that requires the mother to go to this hospital instead of this lower level of care. And it just stuck with me because, I started thinking about this NICU, and, I thought it was going to help so many people, and it would. But it's also clear to me now that we weren't really addressing the bigger issue that caused that NICU to be needed. And it made me consider how much money organizations like small and like well-meaning NGOs and organizations like USAID have dumped into projects without talking to the people supposedly benefiting from them, and seeing where the root of the issue really lies. And that honestly kind of created this part of me where I recognize now that policy is so important in medicine and, preventing people from being sick. But on the other hand, I also want to be able to treat the people who are currently sick. I don't think we should be okay with abandoning those who are suffering from the result of these injustices. But I also think it's super important that we focus on addressing the injustice itself.
Yeah, I could imagine why that quote stuck with you. And I think it's a this and type of situation because, yes, at the end of the day, we would like public health to be the largest force doing a lot of the work and not have to worry about the medical system as much. But at this point in time, we know that there is so much need, and you need to help with the need right now while you're building up the infrastructure. And hopefully public health gets more funding and everything like that, and we get more policies to ensure that we are also focusing on the preventive part of it, so that in 5, 10, 15 years time, there's less medical need and more preventative services. And I can't remember where I heard this, but someone was I think it was a podcast I was listening to. Someone was saying that care for mothers and babies should be happening like 2 years before they even get pregnant, before conception. That's the kind of thought process. Why don't we get them into care and have all these things thought about even before they even thinking about pregnancy or getting pregnant or anything like that? And our system is set up in a way that people are coming, they don't know they're pregnant, and then they're dealing with all these things that could have been prevented if there was a system in place to really address and connect people at an earlier stage. But I appreciate 100%, that.
Yeah. And it's the sort of thing where like that instance really, I'm seriously considering like pediatrics, in med school, because that instance made me realize that this is the most vulnerable population. Anything you do to these children that at this point in their life will affect them for the rest of their life.
Yeah, that makes a lot of sense. And the CEO of the organization I would work for, the Cape Breton Charitable Trust, she was a pediatrician, also got her MPH as well. And I think there is like a fine line between those people, because I feel like pediatricians are generally speaking, the people that are most focused on that preventative aspect. I could be like completely off in saying that, but I'm just gonna throw it out there anyway. But yeah. So I can see why like your mind is there, because as you said, and as we know, especially in public health, a lot of investment in early ed and like just children and their development leads us to so many cost benefits in the future and prevent so many other issues. So yeah. Okay. Well, thank you. I appreciate you sharing that, and look forward to seeing where your journey goes. Okay, so before we get to the Furious 5 last section of the show, I would like to ask you, where would you like to see yourself in the future? And I guess I should have said my comment just now after this question, but where would you like to see yourself in the future?
Yeah, so like I said, I'm pretty committed to becoming a doctor, and right now, like pediatrics and honestly, emergency medicine are pretty high up on the list for me. But I also want to keep that strong focus on global health and public health. Continue working towards addressing and advocating for like the removal of those barriers that keep people in low income, low resource settings from being able to access the same level of care that people like me in high income areas are lucky to be able to access.
Yeah, that makes sense. And we look forward to that journey. And I'm glad that you're taking this going into medicine, wanting to go into medicine, like really with that global health, public health perspective and preventative lens, which I think is needed a lot more in the medical field and is not seen enough. So
Yeah.
glad that you have that perspective. Look forward to seeing where that path takes you. Okay, so moving on to the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health or neuroscience, I should say?
So I'd say the first thing is find an issue you're passionate about and get involved. As you've seen, a big part of my college experience was surrounding myself with different clubs and programs that focused on like big issues in public and global health, and not only gave me like great exposure to those issues, the ones I'm passionate about, but also like it opened the door for me to meet people that are already involved in those areas and ask them for advice and help in getting to where I want to be. And related to that, I stress, don't be afraid to ask. Just in general, don't be afraid to ask people for help. Don't be afraid to ask people for advice. I certainly wouldn't be a BHI if I hadn't reached out to that professor and asked for help. And I can't tell you how many times I've asked for help, with my ADHD. Yeah, so those are the 2 big pieces of advice.
Great advice. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
So BHI is always looking for people passionate about these sorts of issues. So I'd really encourage people to hop on our website at buildhealthinternational.org and take a look at our hiring page.
Yeah, people are always more likely to get hired if they reach out to current employees. So you'll hear where you can connect with Pedro and hear more about his insights and go
Absolutely.
from there. Awesome. So number 3, what's something you're working on to improve in your life right now?
So I've actually always been sort of a perfectionist, and it sort of clashes with my ADHD in that, at the same time I want to get something done really well. There's also like the time management issue that comes from it. So I'm working really hard on trying to disconnect my sense of like worth from my productivity. I've been trying to make sure to celebrate the little wins here and there and be more forgiving with myself if I don't end up finishing everything I wanted to do today. That's one of the big ones. And then, I'm also trying to work out more as well. Since graduating and like partly because of COVID, I've been much more sedentary than I used to be. So I've been trying to go outside more and go hiking and whatnot. Yeah.
I love that. And that's advice I think everyone can take something away from. Number 4, professionally, do you recommend anything?
Yeah, for me, my biggest growth was always when I was able to find like a mentor. So I'd recommend reaching out to people involved in the areas you're interested in and try to develop that relationship. Outside of that, your podcast has been a huge help. I've definitely learned a lot from your guests and the stories they share. And I've always been inspired by the ones that come from the more non-traditional path to public health and medicine. So shout out to Omari for the public health millennial. And another podcast has been really great for me was called Hacking Your ADHD by William Kerb. And he explores the ways you can work with your brain, and like with your ADHD brain specifically. And it's really great because on top of the super helpful tips he gives, it's also really nice to like feel seen. To have someone call out exactly what you've been experiencing and have been able to put into words. It's been super cathartic. So definitely recommend that podcast.
Yeah. That's awesome. And I'll be sure to put that in the show notes. And for someone who doesn't know how to go to the show notes, it is the phmillennial.com episode and then whatever episode number it is. So for example, it's going to be episode 116. So the phmillennial.com/episode 116. And you get to the show notes. Someone has asked me that question, so just putting that out again. But last but not least, where can people connect with you?
Sure. So people can connect with me either through my profile at Build Health International's website or through my LinkedIn. Yeah.
Okay, awesome. And I will also put that in the show notes. So be sure to check that out if you're willing and want to talk to Pedro or want to check out those positions at DHI also. But thank you so much for coming on. I really appreciate you sharing your story. I look forward to seeing where you go in your journey. I appreciate you like just being authentic about your story and sharing the challenges and how you're able to get over them. And I look forward, as I said, look forward to seeing where you end up.
Thank you very much, Mario. It's been a pleasure.
Pleasure is all mine. So housekeeping items, everyone. Thank you so much for watching and listening to this. Be sure to subscribe if you have not. Leave a like, leave a review, 5-star review, hopefully. Share it with a friend. Not hopefully, definitely leave a 5-star review. Share it with a friend. And I greatly appreciate you all. See you all next week. Peace.